name is Jasmine, a practical nursing student, and this is my video for physical assessment on the head, face, eyes, ears, neck, nose, and throat. For today, I have my patient, Miss Lisa Pastera. Good morning, Miss Pastera. My name is Jasmine. I'm gonna be a nurse assessing gonna do your physical assessment for your head and for your head, face, eyes, ears, neck, nose, and your throat. Is that okay with you?
Yes.
Okay, we're gonna start from the head. I'm gonna touch your head, okay?
Yep.
In a bit. But for now, I'm gonna do the inspection and also assessing your head. I can see that your head is a normal cephalic and it's aligned to your spine. Your face is no facial drooping, and also there's no lesion, and there is no involuntary movement. And your also skin is appropriate to your ethnicity. Okay? Everything is okay?
Yes.
Alright, can I touch your head now?
Yep.
Okay. I'm gonna touch your head. Your head is there any pain?
No.
I'm gonna palpate it, okay?
Okay.
Alright, so there's no pain, no tenderness, no lumps, no lesion. The hair are fine, and the color is black. There's no lice and there's no infestation. Oh, it's really good. Now we're gonna do to assess your ears. Is that okay?
Yeah.
Okay, what I'm gonna do is I'm gonna look and palpating both ears. And since you are an adult, I'm gonna pull it up, the pinna, and then up and back, so I can see it very well what's inside. Okay. All right. So okay. So both ears are equal. No discharge. And no pain. Do you have pain? The mustard
No.
also. No pain with the mustard?
Yeah, no pain.
Okay, good. Now I'm going to use my otoscope so I can see your external auditory canal. Is that okay?
Yep.
Okay, now I'm gonna pull your pinna up and then back since you're an adult. Oh, I can see that your tympanic is pearly gray. The tympanic membrane is pearly gray, no bulging and no redness. Okay?
Okay, thank you.
That's good. And now what we're going to do is we're going to do a whisper test, which is, we call it a whisper test. We're going to do a whisper test. To do the whisper test is that you're going to close your one ear, which is from your tympanic. It's right here. And behind you, I'm going to whisper, and then you're going to repeat after me what I'm saying. Okay? We're going to start from your right ear. Hello. Oh, no. Sorry.
Hello.
And then the other ear, you can put down.
How are you?
Okay, and now that's really good. You can hear, and you can repeat the same word. It's really good. Now we're gonna do the another test. We call it the Weber test. This is to check your hearing if they are equal both ears. Okay. Now we're gonna use this one. I hope it's okay with you. And then Mrs. Pastera, what you can do is that I'm gonna put this on top of your head, and then if you can hear the buzzing sound, you can tell me. Okay, you can say now, and then let me know. Okay, if you can hear it equally from right and left.
Yep.
Can you hear the buzzing sound? It's left and right is the same?
Yes.
Oh, it's okay. So there's no problem about your hearing. Okay, that's good. So now we're gonna do another test, which is
A
the
stethoscope.
yeah. It's supposed to be like some people they have lateralization. It meaning that they can hear louder from the, let's say, from the left side of their ear. It's that is lateralization kind of situation. Okay, it means that hearing louder voice from the other ear. All right, so we're gonna do the other test, which is they call it Rene test. I'm gonna test the conduction, the air conduction and bone conduction. Okay, and if you're gonna hear the buzzing sound, just say now. Okay.
Okay. Now. Now.
Okay, so in that case, your conduction is almost the same, so there's no problem with your hearing. Okay, and that's good. Now we're gonna do the. I'm gonna assess your eyes. Um, I'm looking and inspecting your eyes. Are you wearing reading eyeglasses or anything?
Yeah, I'm wearing my eyeglasses.
Oh, for now you don't have to. Okay.
Yeah.
All right. So okay, I can see that your eyes is symmetrical, and the eyelashes are well distributed, and your eyelid are equal, no discharge, and both eyes are okay. Okay. So can you look up for me, please? Okay, now I can see that conjunctiva is pink, your sclera is white, and no abnormalities showing. Okay, that's good. Now, what we're gonna do is to check the peripheral vision. Now, I'm wiggle my two hands, and doing that, I'm gonna do this one from behind, going forward. And if you can see, you can say now. Okay.
Now. Now.
Use the stethoscope.
Now.
Use the stethoscope.
Now.
Use the stethoscope.
Now.
Okay, that's good.
Now,
Now what we can do now is great. That's your peripheral vision. Your peripheral vision is intact. So next we're gonna do is your extraocular muscle. Now, okay, can you look at me to that window? Just straight, looking up to straight, and then without moving your head, and then you're gonna see my fingers going forward in front of your eyes, and then you can see now. Okay.
do you have a strawberry?
Now.
Have a bud?
Now. Now.
What are you eating?
Now.
Oh, that's good. So your extraocular muscles are intact and able to follow my fingers without moving your head, and that is we call it the true cardinal case position. Okay, and now what we're gonna do is I'm gonna assess the pupils of your eyes. The pupils of your eyes. Okay, I'm gonna put the light now and shine it to your. Okay.
Oh gosh.
Okay, your pupils are equal, round, and reactive to the light. Reactive to the light as it's your eyes is shine side to side and back, and the pupils are equal, round, and reactive to the light in accommodation. So the pupil turns from 3 to 4 plus. Okay. Now what we're gonna do is the other test is this one. you're gonna cover your eye, the other eye with your hand and hold this one, or I can do it for you. If you can read for me line number 5, please. Can you read it for me?
PECFD.
Oh, that's good. And can you do the other side?
PECFD.
Do you wear eyeglasses?
Without eyeglasses.
Now, without eyeglasses, you read the lines, and that is your central vision, and then you have a 20/20 perfect vision, and that's really good.
My turn.
Okay, now what we can do is we're gonna do the same thing. Look up to the center, and I'm gonna look at my fingers. I'm just assessing your eyes accommodation. Okay.
I hear it. Okay, have a nice day. Bye. It's my turn. Okay.
Okay, your eyes is normal, as it's the object that get closer. Your eyes constricted and dilated with the near vision, and that is really good. Okay, now we're gonna go to assess your neck.
Where's your eye?
Okay, now I can see that I'm gonna assess your neck. Your neck is symmetrical, and it's symmetrical. Your neck is symmetrical, and no jugular distension, no jugular distension, and no thyroid enlargement.
I hear my.
Oh, that's good.
Pink pill inside.
Now I'm gonna auscultate the carotid artery, and what we're gonna do is I'm gonna use my stethoscope.
No,
Okay.
I want to eat.
Can I borrow the stethoscope, children? Can I borrow the stethoscope, children?
Okay, I'm gonna eat McDonald's. Okay, you need them?
Okay. I'm gonna auscultate.
Somebody down.
I'm gonna auscultate your carotid artery using my bell. Okay. No bruit sound in the carotid artery. Is that good? So next is we're gonna do is
I can eat all the chicken nuggets.
I will palpate the artery. I'm gonna palpate one at a time. Your right and left artery, which is located in between your trachea and your sternocleidomastoid. So it's gonna be right here. I'm gonna do it one at a time, and the other one too. Oh, now your carotid pulse is very strong, and it's regular. The rhythm is both rhythm in both and right carotid pulse. They're regular. Okay, and thank you. Now I'm gonna do what we're gonna do next is I'm gonna palpate your thyroid. Can you swallow? I can feel that the thyroid moves up and down when the patient is swallowing. And can you do it one more time? Yes, it's rising up and down. Okay, that's good. Your thyroid is normal. Now, next what we're gonna do is to palpate all your lymph nodes. Now,
Do you have a doctor's class?
now the lymph node is. No, I'm gonna palpate the lymph nodes. Okay, so we're gonna do still with your neck assessment. So I'm gonna do the this is the preauricular. There's no lump. There's no any pain.
No.
No pain. That's good. And okay, now I'm gonna go with the post-auricular.
No.
There's no sign of node. No pain.
No pain.
Okay, and this is the occipital.
Mm.
No,
No pain.
no node, no lymph node. And then this is the submandibular.
No pain.
No pain. And this is submental. And this is sublingual. No lymph node. And this is the deep cervical chain. There's no. This is the supraclavicle area. There's no lymph node. Any pain?
No.
And this is the deep cervical area, and this is the supraclavicular area. There is no pain.
No pain.
No tenderness.
No.
Okay, that's good. Now, so there's no lymph node enlargement in those areas. And now what we're gonna do next is your nose. No, can you tilt your head for me, please? Thank you. Now I can see that I'm assessing and I'm inspecting your nose. It's symmetrical, and also the nasal turbinate are pink and moist. The nasal septum is in the midline. Yeah, it's in the midline. And also the septum is in the midline, and then the perforation, there's no perforation, there's no polyps, and there's no discharge, no foul odor, and that's really good, right? So now what we're going to check is the patency of your nose. Now you occlude, the other nostril, just occlude the other nostril, and then snip. Make it louder, okay? And then do the other one. One more. Okay. Okay. So your nostril, both nostrils are intact. So that's all. Wrap up my presentation for today. And thank you for my client for today. Thank you so much.
You're welcome.